Yeah, categorizing waste is it all the same? So in this activity, we have decided to go to different places where different kinds of waste are produced and know about the waste that they generate and how do they deal with it. So we have decided to go to first hospital and then we'll go to a mechanic shop. And the activity name is different types of waste. So we want you to guide us with the biomedical waste that is generated in the hospital. So first, would you like to introduce yourself?
Good morning. I'm Dr. Niphezo. I'm a dental surgeon, currently posted here in Naga Hospital. Also the co-convener of the Kayak Committee. So mostly dealing with all the waste, the sanitation and hygiene of the hospital.
So my first question would be what kind of waste what are the types of waste that is generated in the hospitals?
So mostly the type of waste that is generated in the hospital, it is called as a biomedical waste, BMW. Okay? So it's mostly divided into, we use color-coded dustbins. So those, should I go ahead? Okay. We use mostly there are 4 different colors which we normally use in the biomedical waste, okay, besides the general waste. So mostly maybe I'll just show you a picture also, maybe you can also focus here. So, okay, blue dustbin, there's a red dustbin, there's a yellow bin, and then a white bin. So these are the 4 color-coded dustbins which we use. And so mostly all the waste that is generated in the hospitals, so the blue ones will be, this is for all the empty broken glass. So you can also see here the broken glass, all the vials, that injection which we give. If it's a glass, then the glass and the metals, the body implants, this will go to the blue color waste. The red color is usually from the gloves that we use, the rubber and the plastics, the waste. Those are also infected waste. So the rubber gloves, the syringe, the IV sets, those are plastics, right? So those kind of all the catheters, so all those things, mostly the rubber and the plastic, the infected waste, they will go to the red bin, okay, the red color bin. And then we have the yellow. So yellow bin, this is mostly the most infected. I think the most infected waste usually go to the yellow waste. Okay, so suppose we get a patient, so we do a dressing, and the patient comes, and then we do a dressing. So all the soil, the gauze, the cotton, with blood, if it contains blood. Okay, so if it contains blood, or then if we have to cut some of the tissues, we have done some surgery, we have to cut away some of the wounded part. Okay, so all those tissue parts, anatomical waste, it's called as anatomical waste. So all those waste, they go to the yellow bins. Okay, all the anatomical waste, and then the soil, the cottons, the bandages, if it's contain blood. Okay, so they will go to the yellow waste. And also, we do blood transfusion. So the blood transfusion, the blood bag, it is a plastic, right? But since it contains blood, so that will go to the yellow waste. Okay, and then the 4th one is the white bin. Okay, this is mostly for all the sharps. Okay, so when we talk about the sharps, we have the needle, the sharps, the blade, the scalpel, lancets, all those things. So all the sharp waste will go to the white bin. Okay, so this is just the 4 color-coded bins that we use in the hospital. And then the general waste, so it goes to the green or the black, and then we use the okay. And then this will all have this is the biohazard symbol, right? So these are all biohazard symbol. And then so it's segregated. So this is the ward. So all the wards, all the OT operation theater, they will have this color-coded bins. So it is segregated from here, and then the sweeper will collect it, and then they will safely dispose it. Okay, so especially the sharp waste, it's collected here. So this sharp waste, it will go to there's something called as sharp bins. Okay, so it has to go to the sharp lids. So likewise, even the yellow ones, the infected waste, it has to be incinerated. There is something called as incineration, and then some have to go for deep burial. Okay, so that is how the final disposal is done. So deep burial is just mostly any infected waste. If you just throw it in the open, so the flies will come, even the dogs will come in, so it will transmit the infection, right? So deep burial is more of a, it's containing that thing, okay? You open that pig and then you bury that part, bury that part. So some you have in the concrete, you make a concrete one. So, but the hospital like this, it will require a very big one, if not, because it will get up fill up very fast, So, mostly to contain the infection. Okay.
What happens to the blue waste?
Yes.
Waste in the blue waste.
So, blue waste, see, usually the glass and all, it has, what we do is there's something called as disinfectants. There's something called as sodium hypochlorite. So it's first you have to disinfect those. Okay. And then especially some of the glasses and all, if it is recyclable, if it is not an infectious one, you can recycle that also. It will after this disinfection. Okay. After disinfection. Otherwise, even some of the glasses, you have to crush it and then put in the sharp lids. The glass bottles,
Thank you so much for the information.
Yeah.
Sir, do all the hospitals follow the same rule?
Yes. So now what we are doing is almost even all the the government hospitals, all the color-coded dustbins are provided. Okay. So when you go to any government hospitals, starting from the health and wellness center to primary health center, community health center, to district hospital, so almost all the hospitals will have this color-coded dustbins. Okay. And it's mandatory to use this.
Thank you so much, sir.
Yeah. Most welcome.